A report by the UN AIDS indicates an increase in the number of children infected with HIV in developing countries. An assessment done in 21 countries in Sub Saharan Africa shows that while the prevalence of HIV/AIDS is reducing among adults, more children are getting the virus. In 2012, nearly 210,000 new HIV infections were registered among children. United Nations Children's Education Fund blames this on the fact that there is no tracking system to link the health status of an infected mother and that of her child after delivery. This leaves the HIV status of many children unknown.
If a mother is HIV positive, if she has 5 or 6 children, actually all her children should be tested. But at the moment it's not done. We're waiting for the children to become very sick. Then we treat for different sicknesses. Maybe at a certain stage we guess maybe this baby is HIV positive and we do a testing. That's maybe too late.
According to the UN AIDS, only 3 out of 10 children in many countries have access to antiretroviral therapy. Only 4 countries, namely Namibia, Swaziland, South Africa and Zambia, have been providing early infant diagnosis to more than 50% of the children born to women living with HIV. The situation is reportedly worse in Nigeria, Angola, Democratic Republic of Congo, Chad and Malawi, whose coverage of children with HIV is less than 10%.
If you look at infant mortality, most of the children die actually when they are less than 28 days old, which means if you focus on the newborns, then you bring up the number of children who are able to survive and to grow.
Even in countries like Ethiopia, where the cost of HIV treatment is borne by the government, according to UNICEF, out of over 70,000 infected children, only 16,000 are on treatment. Long distance to health centers and ignorance still contributes to some already enrolled children and mothers discontinuing their treatment.
For those mothers and babies who have started ARV programs, treatment, they have once accessed the treatment, we should make sure that we provide enough support so they're not dropped out halfway.
The World Health Organization is releasing new guidelines on the diagnosis of HIV, the care of people living with HIV, and the use of antiretroviral medicines for treating and preventing HIV infection. Health experts are hoping that these new guidelines will increase the number of eligible women and children for receiving HIV treatment and in turn reduce the onward transmission of this disease, improve mothers' health and reduce the child deaths. Coletta Njoy for Press TV in Addis Ababa, Ethiopia.